My research study was on mental health stigmas and using mental health care services. The present study focuses on if negative stigmas towards mental health are preventing people from using services that are available to them and if they have been to therapy. Other studies have been done on mental health stigmas and using mental health services. The hypothesis being tested is that negative mental health stigmas prevent people over 18 from using mental health resources. The study is a descriptive correlational design. A modified version of the Jackson-Hines Comprehensive Health Center survey was used for this study. It was distributed online through the researchers' Instagram, Facebook, and a survey Facebook group, making this a convenient sample. An analysis of variance, ANOVA, has been used to compare the Likert scale survey averages for each participant and their answer to if they had been to therapy. There were 43 participants in this study. The participants were 21.4% males and 78.6% were females, and one person is non-binary. Since there was only one non-binary person, their data was removed. The results were not significant. The scale average mean was very close to being in the middle and/or neutral and having no effect or stigmas. The main effect of gender yielded no significant effect with a similar mean. The main effect for whether the participants had been to counseling or not had no significant effect as well. If more males were added to the sample in the future and patterns observed in this sample held, you would have a significant interaction with males having a negative stigma and having been to therapy. The research question was, do negative mental health stigmas prevent people from using mental health care services? And the hypothesis being tested is that negative mental health stigmas prevent people over 18 from using mental health resources. The DSM over the years has changed their outlook on how to phrase, diagnose, and treat mental illnesses. These changes have affected people's stigmas of mental illnesses and those who have had them over the years. In society, people view mental health differently because they have been influenced by religion, family, friends, and the educational systems they have been in. Other studies, like the one done by Jackson-Hines Comprehensive Health Center, did not find as bad of a stigma as expected. They surveyed 139 people in this study. In a journal about understanding student attitudes, they found that the majority of students do not hold stigmatizing attitudes towards mental illnesses. They surveyed 198 students. Internal stigmas can keep people from receiving the help they need and talking about what they are experiencing. I was curious to find out how those I know and people on campus stigmatize mental health and their opinions on mental health and mental health care services. The method was a questionnaire modified from the Jackson-Hines Comprehensive Health Survey, and it was done online. The questionnaire is on a Likert 5-point scale from 5 as strongly agree to 1 as strongly disagree. Additional questions were added to the original survey that pertain more to the relationships I am going to be studying. A few questions were reversed on the scale so that they would align with the other answers. Without doing so, the scale averages would have been thrown off because most of the questions, like in the example, were 5 having a positive outlook and 1 having a negative outlook. And the few that were reversed were the opposite of this example. There was a second shorter survey so that people could provide their email addresses without it being attached to their initial survey and answer if they would like to be entered into a raffle for a $10 Visa gift card and get extra credit if they were in one of the qualifying courses. This is how they were recruited online on the researcher's personal Instagram story, Facebook, and posted in a survey Facebook group, as well as an email was sent out to other classmates that were not enrolled in this course. Since this was a convenient sample, it was small, and because of COVID-19, there was no in-person recruiting. The survey questions were as followed. The participants were asked if they consented to doing the survey, and they were asked their age, and if they were not over 18, they were sent to the exit screen of the survey. There was a robot check for what year it was. Then the actual survey questions began. They were asked their gender, race, and educational level. They were asked if they had ever been to counseling or therapy. They were asked if they would use counseling services if they were free and anonymous. They were asked if their insurance provider covered therapy or counseling if they would attend sessions. They were asked if they would feel embarrassed or ashamed if they had a mental health problem. They were asked if people would think of them differently if they received mental health treatment, and if they felt comfortable talking about their mental health problems with their primary care doctor or social worker. Other questions that were asked were, I feel comfortable talking about my mental health problems with a counselor or mental health professional. I would feel embarrassed if I went to a setting that was clearly identified as a mental health clinic. And then there were a few that were statement-based with multiple options to agree or disagree with. If I had a mental illness, I would see a doctor or mental health professional, talk to my family, pray, ignore the problem. Another one was, my information about mental illness comes from personal experiences with mental illness, experiences with others who are mentally ill, family or friends, information from TV or radio or films, magazines, newspapers, and books, the internet, school teachers, doctors, nurses, and specialists, or famous people with mental illnesses. Another one was, the causes of mental illness is genetic, psychological, brain function, learning and habit, physical or bodily function, pressure, tension at home, virus, disease, emotional trauma, injury, accident, act of God, ghosts, demons, or spirits, or I don't know. The last question on the survey was, a person with mental illness should be helped by a person themselves with mental illness, others with mental illness, medical doctors or pediatricians, religious leaders, physical or occupational therapists, the person's family, psychologists, psychiatrists, or counselors, institution for mentally ill, or a special care home for mentally ill. The questions pulled from the survey to assess the effects and results were their gender, if they had been to therapy or counseling, and their overall scale averages from the survey. There were 43 responses. There were 9 men and 33 women, and 1 non-binary person who was only included in the data in the next graph. These variables were put into an analysis of variance where their correlations were compared with one another, and averages were found for each participant's survey. This graph shows all of the scale averages for all 43 participants. As shown by the graph, the majority of participants' averages were between 2.5 and 3.5, which shows no significant stigma. There were a few that might be lower than the majority, like participant 34 had a scale average of 2.26, but there was no apparent outliers in this data. The results were not statistically significant. There was no correlation between scale averages, gender, and whether or not people had been to therapy. The external validity is low because of the small sample size. There was no significant difference in the stigmas of females that had been to therapy and those that hadn't. There was a small difference, but it was not significant between the stigmas of males that had been to therapy and those that hadn't been to therapy. This graph shows that difference between the stigmas of men and women that went to therapy and those that didn't. The mean for men who had not been to therapy was 3.26, and those that had been had a mean of 2.93. The women's mean for those that had not been to therapy was 3.27, and those that had been to therapy had a mean of 3.36. If there were more men in a future study, there could be a significant effect between men who had been to therapy and having negative stigmas. It is interesting that the women's stigmas seem to not be affected by going to therapy. If the sample was larger, there may be a small effect. Because of the data at hand, it is slightly higher for women who had been to counseling to have a more positive stigma. The data for women was higher than men who had been to therapy, which would be something of interest to study in future studies. Though there was no effect, this research is important and shows promise. It is a question worth finding the answer to. Do negative mental health stigmas prevent people from seeking services? It would be interesting with a larger sample size to see what the significant effects were, if any, and if with a bigger sample there would be an apparent correlation in what may have an effect on stigmas, like race, age, gender, or other variables, and validity would be higher and reflect the population more accurately. In future studies, things that should be changed or tweaked are the approach to engagement. When reviewing the views on Instagram, there was a lot of lack of engagement. Lots of people saw it but did not do the survey. So this might be something to change in the future, possibly a bigger incentive. Another thing that would give more participants would be a longer time span on the internet for people to take the survey, like a month or 2. Thank you for listening to my research presentation. I hope it was of interest to you and helped you become more interested in mental health stigmas and continuing research on it and related topics.